So the third point, I can summarize by saying, if we want staff to treat members of the public, each other, people in need, with respect and care and dignity and compassion, we have to treat staff with respect and care and dignity and compassion. So people management is enlightened, positive, supportive, enabling people management is fundamental to cultures of high quality performance. And I want to show you some data from the National Staff Survey that we have been conducting over these last 13 years that shows really clearly over time the relationship between staff experience and patient care. So we see really clear relationship between staff satisfaction with their leaders and patient satisfaction with their care. When staff report high work pressure, patients say there are too few nurses, they're not given the dignity or the privacy or the respect that they want. When staff report poor health and well-being, then there's a subsequent relationship with care quality as measured by our inspectorate in these organizations. So the higher the levels of staff stress, the worse the levels of care quality, the poorer, the worse the financial performance. And in the acute sector, the higher the levels of patient mortality. So there's a really clear line of sight between what staff experience and what patients experience in terms of quality of care. Having said that, we know that 50% more staff in the English NHS report debilitating levels of work stress compared with the general working population as a whole. Nearly 40% every year report that they've been ill as a result of stress at work in the previous year. So we're damaging the health and well-being of the very people we ask to care for the health and well-being of others. And we know that that affects patient care. It affects error rates, it affects people's ability to be compassionate, and it affects mortality rates, as I said. And it doesn't need to be that way because we know that there are examples of healthcare organisations in England where they have reduced stress levels and maintained them at a low level, where they've increased patient satisfaction at the same time, and financial performance and care quality. So it doesn't need to be that way. We know that there are really, we published a paper in 2003, I think it was, looking at the relationship between human resource management practices, quality of appraisals, team working, training, as a predictor of patient mortality, and we've done 2 subsequent studies with different data sets showing the same thing. But the most, as I said, significant predictor of performance in the health service in England is engagement, and this reflects what we see in organisations generally, not just in the health service, that where you have high levels of staff engagement, there's better financial performance, improved customer care, sales, innovation, profits, lower attrition rates, and people are, when they're engaged, are advocates for their organisation. They speak up about the organisation publicly with a sense of pride, and they're more creative and they offer more. So, and as I said, in the health service in England, we have this extraordinarily large data set that enables us to do really sophisticated analyses and not just to look at correlations, but to look at relationships over time, taking account of other factors that might explain some of these associations. And engagement is the most important predictor of performance, whether it's in the hospital sector, in mental health services, in ambulance services, in community services. It is the most important predictor, reflecting the kind of findings that we see in the private sector and other areas of the public sector also. So the concept of staff engagement, I know it's part of the staff survey for the Northern Ireland Civil Service. It figures very prominently. What does it mean? So if you go back to the root of the concept, it was developed in the 1990s by an academic, Daniel Kahn. He talked about, to understand this concept, he said, what's the theatre in Belfast? Is it the Royal Court?
The Opera House.
The Opera House. Imagine an actor coming to perform at the Opera House on a Saturday night. Engagement is the extent to which she brings of her life experience to the performance of the role. She brings of her emotional intelligence, her creativity, her courage to the performance of the role. So when we talk about staff engagement, what we're saying is it's the extent to which staff bring of their life experience, their creativity, their commitment, their courage, their emotional intelligence to the performance of their work. So what do we as a leadership community have to do to create the conditions where that's going to happen in a way that is enriching for the people who work in our organizations? And we have some data from the NHS staff survey around the importance of leadership and supervisory support and quality of team working and role clarity and not being utterly overloaded in the workplace and support from colleagues. We've also been looking at those organizations that have very high levels of engagement and have sustained them, have raised them and sustained them in the NHS in England, and attempted to synthesize out what are the core characteristics. And there are 5 that emerge as really important. The first is that these are organizations that have a compelling strategic narrative, and we've talked about this already, so I don't need to spend much time on it other than to say that where organizations have a clear narrative on their purpose and it's understood throughout the organization and believed, then people are more engaged. Second, these are organizations that have generally retrained all their leaders to adopt a more positive, supportive, enabling leadership style. So one example that I'm familiar with is of a number is Nottinghamshire Healthcare Trust, which has developed a program called Invest to Lead. It's a big mental health trust. And they have retrained their leaders largely in-house. They do send them away on some training courses, but most of the development is in-house. Lots of coaching, lots of mentoring, lots of in-house training courses focused on leaders being supportive and listening and enabling and positive. So they have this kind of theme of positivity, and depending on the level of training you've experienced, you get a little enamel badge of either a red or a blue colour with a big tick on it as a kind of public indication of your rite de passage, if you like, of going through this leadership training. And it's had a transformational effect on the culture of the organisation. Third, these are organisations that have devolved responsibility to frontline staff for service improvement. So they've said, they've not just said, we want staff to see quality improvement as their job, go out and do it. They've trained them. They've given them the training and the skills, whether it's PDSA cycles, Six Sigma, lean, whatever. They've given people the training, and it doesn't seem to matter what the training is. It's more to do with the context in which it happens. So they've also tended to provide the time and the resources for staff to engage in quality improvement projects. Wrightington, Wigan and Lee is a very successful NHS trust in the northwest of England. They've partnered with Unipart, a car parts distributor, to adapt the lean techniques that they use in Unipart to use in the hospital very successfully. And again, they've provided training for their staff in quality improvement. So they've now got 350 quality improvement champions. And depending on your quality improvement activities, you get a badge again, a gold, silver or bronze quality improvement badge. Bronze if you've implemented a quality improvement project in your area. Silver if it's been implemented as well in another area of the organisation, and gold if it's been implemented as well in another organisation altogether. And at any one time they've got around 150 quality improvement projects going on within the organisation. So improvement is built in to the DNA of the organisation. And the fourth is, and most importantly, is that these organisations are places where there seems to be a really high level of trust in senior leadership, where staff report trust in senior leadership, and interestingly, where staff in minority groups, like black and minority ethnic group staff, report that there is relatively high levels of equality in terms of career progression. Perceptions of discrimination by minority groups, whether it's people with disabilities or people from BME backgrounds or Muslim religion, perceptions of discrimination are a really important barometer of levels of trust, it turns out, within these organisations. And it is, it kind of plays out at the level of the team, Siobhan, as you were saying. So we know that leaders have favourites. So everyone in this room has favourites. There are people who are like us, or who we find it easier to be with, easier to have conversations with. And then there are people who we lead who kind of feel like they're not like us, or they're a bit more difficult to interact with, or we just don't feel so comfortable with them. So we create in-groups and out-groups as leaders. All of us do this. And it's very interesting. This is this approach to understanding leadership is called leader-member exchange theory. It is probably the leadership theory with the best academic support. There's more empirical evidence to support this understanding of leadership than almost any other. And where the so the way we interact with these in-groups and out-groups is different. We spend more time with the in-group people than we do with the out-group people. We attribute the success of in-group people to their competence and the failures to circumstances, and we do the reverse for the out-groups. Does that make sense? You with me? So what leader-member exchange theory and the research shows is that where the gap between the greater the gap between the least preferred co-worker and the most preferred co-worker, the greater the gap, the worse the leadership performance, the worse the team performance. So, of course, people know which group they're in, whether they're in the in-group or out-group. And so it has a significant effect on trust, on perceptions of fairness, and so on. So it's a really important understanding of leadership that applies to all of us. And the implications are, of course, the importance of spending more time, of engaging more compassionately with everybody we lead, of listening with fascination to everybody we lead in our teams. Make sense? And so, by the way, we also discovered that these are organizations that generally have had relatively stable senior leadership teams. So the average tenure of a chief executive in the health service in England is less than 2 years. And the same applies to chief financial officers, slightly longer, and chief medical officers. So when you have that high level of turnover, then the kind of stability that you were referring to earlier, Tommy, where you achieve a shared vision and shared values, much more difficult to achieve. Anyway, so I went to Wrightington, Wigan and Lee about 18 months ago now, to learn more about how they'd been so successful in raising levels of engagement. And I attended their engagement committee, and they kept talking about the horse. And anyway, it turned out there was a patient who was dying on the palliative care ward a few months previously. And one of the nursing staff had asked her if there was anything they could do for her. She had hours left to live, probably. And she said she really wanted to see Bronwyn. And it turned out Bronwyn was a horse that she had raised over a 25-year period because she'd worked at Haydock Park Racecourse. So the staff called the family and said, "Can you bring Bronwyn into the hospital?" So they arranged for a horse box and brought the horse box into the car park and took Sheila Marsh, the patient, out into the car park. And the horse clearly recognized her and and was led over and nuzzled her and kissed her. And one of the staff members caught the moment on a camera phone. So nobody called health and safety, you know, so could we do this? Because there was a culture of engagement and compassion, staff did the right thing and they were supported. And it was really important for Sheila Marsh, who sadly died a few hours later, was really affirming, it was really moving for her family who were there, and it was really affirming actually for the staff as well. So it's, you know, as leaders, how do we create cultures where staff will do the right thing, knowing they will be supported? And actually, you know, enabling staff to have the courage and the commitment and the emotional intelligence to bring all of that to their work on a day-by-day basis. And the last point to make about people management is that we know that positive emotion, you know, over the last 15 years, we've come to understand from research in psychology particularly the huge importance of positive emotion in human behavior. You know, the amount of positive emotion you experience in your life is a predictor of your longevity. The more, if you take the top 10% and the bottom 10% in terms of levels of positive affect, there's on average about a 10-year longevity gap between them. If you induce positive emotion in a 3-year-old, and give her paints to play with, she'll produce more creative paintings, she will behave more altruistically and cooperatively with the other 3-year-olds around. And the same is true of 63-year-olds. If you have positive leaders of teams, then those teams tend to be more cohesive and to perform more effectively. And you know, in the healthcare sector, if you induce positive emotion in doctors, they make better medical diagnoses. If you induce positive emotion in people and expose them to the cold virus, they're less likely to contract a cold. We can go on. You can predict marital outcome by watching a 20-minute period of interaction between a married couple in terms of the ratio of negative to positive interactions. Anyway, it's 5-to-1, by the way, as a minimum. But don't start counting, or you're in real trouble. But the importance, you know, the point is that positive emotion is really important to us. Chronic negative emotion damages our immune system, associated with higher levels of heart disease. You know, the huge civil service study by Sir Michael Marmot in the last century, wasn't that long ago, but you know, this huge study which showed the gradient and the link with levels of negative emotion and heart disease is utterly convincing. So we don't need to add unnecessarily to the levels of negativity experienced in organizations by the way that we lead. It's really important that as leaders, generally, we create a positive environment. This doesn't mean you coming to work or us coming to work on a Monday morning adopting some Ken Dodd sort of persona. It's more about authenticity in the way we behave, being authentic as people, being open and honest and transparent as far as possible, being curious about how we can lead better. So, you know, curiosity as a leader, how can I, tell me how I can provide better leadership for the team. Tell me how I can improve my leadership. It's about being compassionate, and it's about being appreciative of saying thank you to people, of recognizing people. The biggest single complaint we hear from, as researchers, from people in organizations across sectors is people don't appreciate what we do. Our leaders don't come and say thank you. They're quick to come when things go wrong, but we don't hear enough from them about what we've contributed and the difference we're making. So, you know, the importance of positive affect as a leadership community is great, but it's also, as Anthony was saying earlier, it's about the complement of that is we have to deal with those aggressive or intimidating behaviors or really poor performance Because if we don't, then it is basically a corrosive force in terms of the sorts of cultures we're trying to create. Because if we don't deal with intimidating behaviours, bullying, aggression, poor performance, we're saying to people, that's the way you do things around here. So when new people join the organisation, when they see that, they say, well, hang on, this isn't fair, this isn't equal, honesty and transparency don't seem to exist. And when I get to a senior level, I can be intimidating or bullying or aggressive because that's the way we do things around here. So part of creating a positive culture for people in our organizations is having clear strategies and guidelines and approaches to dealing with those behaviors, because it's about creating a consistent culture.